Sexual addiction, or just a high sex drive?
Sexual addiction has not been fully established as a medical condition, although it can adversely affect families, relationships, and lives. The problem with identifying sexual addiction is that people have different levels of sex drive or libido. Someone may think their partner is a sex addict simply because they have a higher sex drive.
One way to work out sexual addiction from a high sex drive is to observe if the partner fails to control their behaviour and whether they continue with this behaviour disregarding the harm caused to others.
Yes, that's very, very important. In some cases, a person with a healthy and enjoyable sex life may develop an obsession. They may find themselves stimulated by acts and become curious and aroused by fantasies that most people do not consider acceptable. A qualified psychiatrist or a psychosexual therapist can help to be able to distinguish that. So Debs, what is sexual addiction?
Sexual addiction is a sexual dependency, hypersexuality, and compulsive sexual behaviour. In women, it's known as nymphomania, and in men, it's known as Satyriasis.
Many people mistakenly believe it isn't an addiction because sex doesn't contain a substance such as alcohol or narcotics. The person is addicted to an activity. Surprisingly, the human body produces a hormone which, during sexually charged experiences, can create the feel-good chemical called dopamine.
Yes, this gives you the same chemical rush as cocaine or heroin, and this triggers the feeling of reward and pleasure.
Fundamentally, sexual addiction involves a person making sex their priority above family, friends, and work, and their lives are organized around gaining their sexual fix. They are prepared to sacrifice whatever they value most to justify their unhealthy behavior.
In other words, like an alcoholic who is unable to stop drinking, sexual addictive characteristics get acted out because the individual, no matter how strong, struggles to control their compulsion.
And it is a compulsion.
So, am I addicted to sex?
I don't know, Debs. But my advice is to consult with a trained psychosexual therapist or a psychiatrist for a proper evaluation. However, you may also want to look out for the following signs.
Okay. You feel powerless with your sexual behaviours. Your sexual choices are making your life difficult to manage.
You feel ashamed, disgusted, and even embarrassed thinking about your sexual acts. You keep promising yourself you'll do something about them, but you keep letting yourself down.
You become preoccupied with sex. It takes over into a ritual you just can't control. And one way to avoid acknowledging your compulsion is by using some form of denial, such as rationalizing or...
I just can't have if I've got a high sex drive.
Blaming or...
It's not me, Debs. You're the one with the problem. Sorry.
Or just minimizing.
Listen, I can't help it if I've got a high sex drive, Debs. I'm sorry.
So Riz, what are the behaviours and attitudes of sexual addiction?
Well, Deb, sexual addiction can be hard to treat, and what causes it is still unclear. However, a person with an addiction will often rationalise and justify their behaviours and thought patterns.
Just like you did before, when you interrupted me.
Yeah, right, Debs.
People with a sexual addiction may use denial as a defence mechanism to avoid facing their problem. There's no distinct category, but sexual addiction can come in different forms, including addiction to behaviours and attitudes.
There are many signs that may suggest a person is struggling with sexual addiction, and here we list just a few of the most important ones.
So one behaviour is the inability to contain your sexual urges and respect others involved in the sexual act. Cybersex, exhibitionism and voyeurism is all part of disrespecting and humiliating yourself and your partner with sadistic or masochistic behaviour.
You can have the attitude of detachment, in which the sexual activities does not emotionally satisfy you, and that can include compulsive masturbation and persistent use of pornography.
You can become obsessed with starting new romances for the rush of feeling in love, multiple affairs or sexual partners, and one-night stands, and you may even fail to resist impulses to engage in extreme acts of lewd sex.
You will deny that your urges are uncontrollable, even though you are aware that you're struggling, and you will continue practicing unsafe sex or consider even the financial or social implications of this.
You will visit prostitutes or even practice prostitution and frequent public places for sex.
And another behavior is experiencing sexual rage. This is where you become distressed, anxious and restless, and possibly violent if you're unable to engage in the addiction because the behavior needs to increase in frequency and intensity to achieve the desired effect. So Debs, what are the emotional symptoms of sexual addiction?
Sexual addiction, due to its behavioural nature, can be difficult for others to understand and tolerate, especially if it's already led to damage in relationships. If you or someone you love suffers from a sexual addiction, you may feel alienated, isolated, depressed, angry, or even humiliated.
Most sex addicts fear being abandoned. Therefore, you might stay in relationships that aren't healthy for you. When you're alone, you may feel empty or even incomplete. You may also avoid being with your feelings like guilt, loneliness, or fear, and relieve them with masturbation. Untreated compulsive sexual behavior can develop into severe anxiety and depression. So, Debs, let's conclude.
Okay. All addiction is about escape from the emotional pain that is unbearable and overwhelming to be with. Addictive behaviours do a great job of numbing your pain, and your dependency will stop being about experiencing pleasure and become, sadly, about survival.
That's very sad. So, it is important to know that recovery from sexual addiction is about addressing the emotional symptoms of depression, social anxiety and isolation, and support from professionals, family and friends is crucial for you in recovering from this. Having a strong support network helps to reduce destructive behavior and the risk of relapsing.